Hello and welcome to week 12. I can't believe it. We're almost finished, getting there closer and closer. So this week we will be learning about respiratory infections. So I'm doing the lab presentation on video. Since it's a bit shorter, it's a great synopsis of everything, and it should cover the lecture as well. And don't worry, you have those PowerPoint presentations that I've created for you, shortened versions from Pearson, and practice questions, and of course, as always, highlights. So I have like a study guide highlight for you for this week as well, just to make sure that once you have read through the chapter, have gone through the PowerPoints, then you can do the review and of course, the review highlights alongside practice questions as always. All right, so I do hope this video helps you, and it'll be, you can find it, you will find it in the announcements for the lecture, as well as the announcements for the lab, okay? And then of course, Dr. Morgan can reinforce it when you see him on Friday covering me. All right, so let's get started without further ado. Week 12, infections of the respiratory system. Here we go. So the infections in the respiratory tract are very common. This is one of the most common types of infections. They occur from any type of agent. It could be viral, it could be bacterial. It can even be other organisms such as fungal, getting candida, for example. So a sufficient number of infectious agents must be inhaled properly in order for you to get an infection. The infectious agent must be airborne for you to get a respiratory infection. So the infection is airborne and contained usually in a droplet. The infectious organism has to be alive and viable while in the air and inhaled through the nose or through the mouth if you're a mouth breather or doing both, okay? So once it hits the respiratory tract, the organism has to be able to colonize along the surfaces of the structures along the respiratory tract, okay? So if it cannot land and colonize, it's not going to live. And so the whole point of having mucus is the exact reason, since it's kind of like a net, it catches and holds on to the pathogens to prevent it from spreading elsewhere. Okay, so those are the reasons for a respiratory infections. These are the ways in which infectious agents can actually enter and infect. Now, the most common, and everyone has come into contact with it, either you had it or somebody in your family had it, strep throat. So this is called group A streptococcus, and streptococcal pharyngitis is your throat is red, it has patches of colonizations of these streptococcal group A organisms. And it can occur at any age, but it is more common in children. However, college age students also are prone to it, and adults can get it as well. So the transmission is through person-to-person contact. It is very common in college age students because there's a lot of communication in the classroom, in the dorm rooms, etc. And so this is a way of getting the strep throat. It's a rite of passage. Now you notice I like this lab presentation. It's from Elsevier. It's not from our book. I dolled it up and I created my own style, made it short and sweet. So you'll see that, you know, as you read through the chapter, which I highly encourage, and you read through the highlights, which I highly encourage, this is a supplement and a supplement only. Don't just count on this. Although I can say that some questions will arise out of this, okay? So just so you know. So now the next one is scarlet fever. So scarlet fever is group A beta hemolytic. So what's the difference? Let's go back. Let's go back one. So group A causes streptococcal pharyngitis. Why am I pointing this out? Because this is a common test question. Now watch this. Group A beta hemolytic, all right, causes scarlet fever, okay? So what's the difference? Well, it's just a little bit different because it causes different symptoms, okay? The incubation period is 1 to 2 days, but it causes strawberry tongue due to exotoxin release. So this one is pretty bad. This one is called beta hemolytic streptococci or streptococcus pyogenes. And this one causes exotoxins and you need antibiotics right away. If you don't get antibiotics, you can get that type 3 glomerulonephritis and even heart valve damage where the bacteria could settle into the mitral valve and literally damage your valve and cause mitral valve prolapse and mitral valve regurgitation post-infection. Okay? Now, the next one, so there's a lot of different streptococcal species. This next one is very common as well. This one is called Streptococcus pneumoniae. So Streptococcus pneumoniae is also gram-positive. It's encapsulated, and it has an alpha hemolytic diplococcus or pneumococcus structure. So this one is not as bad. It's a mild respiratory illness, but if it gets out of hand and you don't get antibiotics, it will cause pneumonia, especially in older people. So this one, it's not as acute as the other two. It causes minor respiratory illness, but if the person is immunocompromised or elderly, this will definitely turn into pneumonia if left untreated. So typically the highest at risk are the young children, the elderly, those with medical conditions, autoimmune disease, so other immunocompromised people such as diabetics. So think about autoimmune such as, lupus, EDS, rheumatoid arthritis. All these are autoimmune. Hypothyroidism has been found, and hyperthyroidism has a component, especially the autoimmune type, right? The Graves' disease, all right? So typically we have a vaccination for this to prevent, you know, a dissemination each year and to prevent deaths from pneumonia because of this infection. All right, next one is drug-resistant streptococcus pneumoniae disease, DRSP. So this one, DRSP causes pneumonia, bacteremia, otitis media, which is ear infection, meningitis, peritonitis, sinusitis. So what's peritonitis? Well, inflammation of the peritoneum in the abdomen. So this can cause a lot of serious issues and high morbidity, mortality rates. So the contributing factor can be overuse of antibiotics, emerging resistant strains, for example. Outbreaks are found, this is the one, DRSP is found, drug-resistant streptococcus pneumoniae is found typically in child care centers, in nursing homes, and institutions where HIV patients reside, HIV infection patients live. So pneumococcal conjugate vaccine is available to prevent DRSP since this is a serious infection and it spreads like wildfire in the nursing homes, for example. The next one is Mycoplasma pneumoniae. This one is primary atypical pneumonia. It's relatively mild. It's usually affecting people younger than 40, so you're not going to see 55 or 50 and up. Transmission is through respiratory droplets, person to person, and this spreads due to crowded areas. All right. So there's so many. So let's just go over all of these that are common, right? So the next one, it sounds bad, right? Chlamydiophila pneumoniae, but this is one of the major causes of pneumonia or bronchitis. The transmission is respiratory secretions. It's most commonly found in school-aged children. It's called community-acquired pneumonia, and it's easily passed from one individual to another. So this is your typical kids catching pneumonia. Now, this is, it is very serious. It's not something that should be taken lightly. And young school-age children that get this typically will have to get hospitalized for a couple of days and get IV antibiotics. The next one is pertussis. This is a very serious bacterial infection. Bordetella pertussis is the bacteria that causes whooping cough or pertussis. Okay, these are aerobic, pardon me, aerobic, not anaerobic. So they require oxygen. They're gram negative, not gram positive. They're gram negative coxobacillus. They can cause permanent disability and death. Ergo, we have a vaccine for it. Unfortunately, there is still some vaccine hesitancy out there. And so less and less people are, less and less children are getting the whooping cough vaccine, and pertussis is now back. It typically is a very bad cough. It sounds like a barking cough. That's what they say it sounds like. All right, so that's pertussis. So I highly recommend that you vaccinate. If you have children, vaccinate them for whooping cough. Pertussis vaccine is available. The next one, not many people get unless you're in the right population to be at risk. Tuberculosis. So, pretty much tuberculosis is closer, in third world countries, yes, it's more common, but also in inner city, it is more common. HIV population due to immunocompromise, it is more common. It is caused by Mycobacterium tuberculosis. It's transmitted through air. Its infection is spread by the person coughing, sneezing, or even just talking. As you know, we release saliva when we talk, and it usually infects the lungs, although it can spread its spores and literally be latent even in the bone as a spore and then pop out, germinate at some point later, years later. So infected persons may not show signs but have latent tuberculosis. The initial symptoms is fever, night sweats, and loss of appetite. Some may go into remission and some become more chronic and debilitating. Rifampin is a drug of choice. Rifampin is taken for a year. And we do have the TB vaccine available. Transmission can be largely prevented if infected persons are identified quickly, isolated, quarantined, and put on an antibiotic regimen. So excuse me if I keep rubbing my eye, but I have like an eyelash stuck in my eyeball. Okay, it's quite annoying. So if you see my eyes like bulging, it's because I'm trying to get rid of it. I'll have to get Visine. All right, next we're moving on to something less serious. A lot of people tend to struggle with this, including myself right now. Sinusitis can be caused by viruses, bacteria, and fungi, usually secondary to a head cold or allergy. There's generalized congestion, fever, and sore throat. So the typical treatment is decongestant, analgesic, and antibiotics if needed. All right, the next part of our lesson is to be able to describe rare and opportunistic respiratory infections caused by bacteria. Then we're going to talk about comparing and contrasting the common cold and influenza, their prevention and treatment. And then we're going to finally talk about describing the infections of the respiratory system that's caused by fungus, how to treat that. And then describing the common symptoms of upper and lower respiratory infections and the possible treatments and prevention. So let's talk about staphylococcal pneumoniae. So staphylococcal pneumonia is rare in healthy adults. It's common in immunocompromised individuals, usually hospital and institutionally acquired. Penicillin is the treatment of choice, although there is resistance now. So since more strains of Staphylococcus has become resistant to penicillin, the use of vancomycin may be required. And if that doesn't work, we go to daptomycin, cubicin, all that. We've talked about that previously, right? All right, now we move on to Haemophilus infections. So many people confuse this because it sounds like a virus, right? When we say Haemophilus influenza, we're thinking it's influenza, but it's not. Haemophilus influenza is actually a bacterial infection by the group Haemophilus, and it's a gram-negative coccobacillus, commonly causing bronchitis in children, chronic bronchitis in adults, and eventually may cause meningitis. Next one, a very rare opportunistic infection. This respiratory infection is called Klebsiella pneumoniae. So Klebsiella pneumoniae is a gram-negative encapsulated bacillus, most often hospital-acquired. The at-risk patients are infants, older patients, alcoholics, persons with chronic disease. The fatality rate for Klebsiella pneumoniae is 25 to 50%. Remember that number because it's pretty high. So yes, it's a rare infection. It's a rare respiratory infection that causes pneumonia. And there's a 25 to 50% mortality rate, so that's not good. So remember that. Next one, rare and also opportunistic, is diphtheria. We have a vaccine available for diphtheria. We have the slides in the lab if you want to look up in the micro lab, looking up the Corynebacterium diphtheriae. They are facultative anaerobic, meaning they can manage aerobic, but they prefer anaerobic. They're gram-positive bacillus. They infect the throat and the nose and generally just cause upper respiratory infections. However, they form pseudomembranes on the tonsils and throat and cause life-threatening obstruction so that you can't breathe. The bacterium produces an exotoxin that can potentially spread into the blood, cause septicemia, affect other organs, excuse me, including the heart, damage the heart. Therefore, it's very important that you take the diphtheria vaccine and prevent this diphtheria infection from happening. Next one is caused by, believe it or not, we discovered it through, I think it was the 1960s or early 70s. There was a hotel that had an AC unit that was had a huge culture of Legionella, and everyone called it Legionellosis, but the bacteria is called Legionella pneumophila. It's a gram-negative bacillus. Again, it's a rare opportunistic infection, but if the AC unit is old, the water has not been cleaned, and the water is stationary, has not been changed, bacterial buildup can create this culture of Legionella pneumophila. Now, what does it cause? It causes upper and lower respiratory infection. And how is it contracted? By inhaling literally the water mist containing the organism. And it is quite difficult to distinguish in a micro lab. So further testing has to be done to specifically isolate. So you might not find anything, but if Legionella is suspected, you have to test for that specifically. So it's not on the general lab orders per se, just so you know. All right, so when this is suspected, there has to be signs and symptoms and clinical description. Hopefully the patient tells you where they were and how, the situation. So this may be hard to find. And so it's a last ditch diagnosis once everything else has been ruled out. All right, other rare opportunistic infections, psychosis, chlamydia tsitsiki, which is found in bird droppings. It's spread from birds to humans. The treatment is antibiotics. It causes fever, chills, headache, muscle ache, dry cough, often causes pneumonia. But again, this is a rare opportunistic infection. You have to have been around a lot of birds. So again, it's also a diagnosis through ruling out all the more common infections. All right, now really rare is anthrax. So Bacillus anthracis is a gram-positive. It unfortunately is spore-forming. Why unfortunately? Because, well, it can be inhaled and it's very hard to get rid of it in its spore format. Once they germinate and release, they're facultative anaerobes. So they prefer an anaerobic environment, but they are facultative, which means they are adaptable. They're found in wild and domestic vertebrates. The infection occurs through skin, so you have to have touched it, inhaled it, or ingested it. There's three ways. So this one's very opportunistic. Other, respiratory infections, as I mentioned, was only through inhalation. Well, this one, it's very opportunistic. You can inhale it, you can ingest it, and like I said, you can get it through the skin. It's a terrible way to die. It releases a toxin. Once the spores germinate, you're SOL. You're literally at death's door unless you get treatment, and even then you may still die. Why? Because the release of the toxin causes internal bleeding, swelling, and tissue necrosis. All right, I didn't put this down, but pretty much once you have internal bleeding, it's 90 to 100% death. Next is Q fever. This one is pretty rare. It's a zoonotic disease caused by Coxiella burnetii. This is a gram-positive, spore-forming coxobacillus. Unless you're a farm worker, you're not going to get this, but this is globally caused by being in contact with sheep, goats, cattle, farm dogs, cats, birds, rodents, ticks. All right, so if you work on a farm, an organism can be excreted in the milk, urine, feces. It is resistant to heat, drying, common disinfectants. So disinfectants won't work. It is resistant to heat. All right, so that's a problem. And the human infection is caused by inhaling the organism through barnyard dust, birth fluid. So let's say you're a farmer helping a cow give birth or something like that. Extracts from infected herd animals, bites from infected ticks. All right. So what are the symptoms? Fever, headache, muscle pain, cough, chest pain during breathing, shortness of breath, jaundice, and here's the clincher. And yes, it will be a test question, hint, hint. Clay-colored stool. So typically when we ask questions about all these infections, this one, it's rare. Not many infections cause clay-colored stool. Now the urine for rifampin for TB is red. So remember all these things when you're, taking tests, all right? So clay-colored stool, Q fever, Coxiella burnetii. Antibiotic must be done early in the disease or else this could be fatal as well. All right, so about 90% of acute respiratory infections are going to be upper and acute, and then 50% of lower respiratory infections are caused by viruses, okay? So viral infections are pretty much 90% of all respiratory infections, and 50% of lower respiratory infections are caused by viruses. What does that mean? The other 50% of lower respiratory infections are bacterial. All right, and then towards the end of this presentation, I'll talk about fungus among us as well, which means I'm going to talk about candida and all those other ones. All right, so everyone knows about the common cold, so let's talk about it. So we've done all the bacteria and all the esoteric bacteria. Now we're going to go over viruses. So the common cold lasts 3 to 5 days. Rhinitis, runny nose, nasal congestion, sneezing. Everyone knows about this. Common precursor for ear infections is a viral infection. It starts out in the nose, right? A rhinovirus. We have more than 200 different cold viruses. It is highly contagious, spreads rapidly. There is no specific treatment, as you know, except rest, lots of fluids, over-the-counter medications to relieve the symptoms, decongestants, etc. All right, let's talk about influenza. Influenza is a little bit worse than obviously the cold. It's caused by orthomyxoviruses, person-to-person infection, or fomite. What's a fomite? We talked about fomites for months and months since we've been taking microbiology. Any surface that may be a nidus for infection. All right, so a dirty table, a bathroom knob, I don't know, so many things, right? Anything that you touch, then you touch your nose and eyes, rub your face, and you get it. So flu patients are more susceptible. Once they get the flu, then they're more susceptible to bacterial infections. And that's how they end up with other coexisting lower respiratory infections, ending up with bronchitis and pneumonia, which we already went over all those bacterial infections, right? So a new flu virus variant can cause some damage. And, definitely you go through a whole 10-day course of, the antibodies developing, your B cells finding the right antibody to cover this particular variant of the virus. And of course, your T cells coming in, remember all that. T helper and the T cytotoxic and your neutrophils and all that. So your immune system, it takes a long time when you have the flu, 3 to 4 days to mount a full immune response. And then by day 7, you should be better. By day 10, it's resolved. And that's your highest antibody level for that particular variant that you'll ever have. So if you get that variant again, you will be immune. You may not even have symptoms if you're exposed to that variant again within 6 months. All right, so you can also have some gastrointestinal symptoms from the flu, nausea, vomiting, diarrhea. It is more common in children than adults to have the GI symptoms. The epidemics usually occur in the United States during winter, and as you know, we do have vaccinations yearly. All right, viral pneumonia. About half of all pneumonias are caused by viruses such as influenza virus, adenovirus, Coxsackie virus, chickenpox, measles, cytomegalovirus, respiratory syncytial virus. The symptoms are fever, non-productive cough, rhinitis, myalgia, and headache. Different viruses may cause different symptoms. Let's go over them. So we're going to go over HPS. What is HPS? Hantavirus pulmonary syndrome, caused by hantaviruses, deadly disease carried by rodents, transmission through contact with infected animals, their urine and or droppings, acute respiratory distress syndrome, fatalities 30 to 40%. This is more West Coast, Arizona. There has been a lot of infections in that area with hantavirus. All right, SARS, severe acute respiratory syndrome, SARS coronavirus. Okay, person-to-person transmission through respiratory droplets. We all know it can be life-threatening. High fever, headache, pneumonia, body ache, dry cough, followed by full-on pneumonia. So obviously, we've realized that steroids are the treatment of choice now, and not ventilatory support. Antipyretics, and we do have antiviral medications right now to catch it quick, but it has to be done within the first 72 hours. It would be best to get it then, the antivirals, so that you reduce the symptoms and shorten the whole span of the infection, so you can heal faster. All right, supplemental oxygen if needed, all that. So I really did a short 2 slide here because we all went through a pandemic. I don't need to tell you. So SARS was started in 2019, COVID-19, 2019. The first case was in November, and the pandemic was declared ended in 2021. We did have many variants. And the biggest problem was the cytokine storm, which we already talked about when we did the immune system, so I don't need to review that anymore. Increased severity in ages 65 and up, and those, of course, with comorbidity factors such as autoimmune diseases, diabetes, etc., hypertension, and even heart disease. All these people are at risk. The cases were less severe in children who were at lower risk, and we now have mRNA vaccines available, and therapeutic regimens are being developed. All right, so I'm going to move away from that and on to histoplasmosis. Histoplasma capsulatum. This is causing acute respiratory infection, primarily affects the lungs. Transmission is again airborne conidia this time. So conidia are, uh, think of it like cones, okay? The reservoirs are in the soil of old chicken houses. That's why I have the little cute little chicken there in your palm. Cute but deadly. um, Starling, bird roosts, bat caves. I don't know if you're ever going to go into bat cave unless you're Batman. Haha. Just a really cheesy joke. Sorry. Uh, Most infected persons do not show any symptoms. With heavy exposure, you may get some symptoms such as fever, headache, non-productive cough, and it is a progressive disease that generally occurs in young and elderly, also found in immunocompromised individuals. All right, this one is found in the desert. So, southwestern United States, parts of Mexico, and a lot of places in South America. It is a fungal infection. So, I'm moving on to fungus among us, moving away from all the viruses. So, this is a fungus, coccidiomycosis, caused by Cassidi. Okay, let me see if I can pronounce this. I always mess this one up. Coccidioides immitis. All right. So what's the transmission? Inhaling airborne anthracoonidia, 60% infection rate, no symptoms with those that are infected, but 40% that do get infected have mild to severe symptoms. What are these symptoms? Cough, chest pain, fever, chills, night sweats, headache, muscle stiffness, muscle aches, joint stiffness, rash, blood-tinged sputum. Okay, so how do we distinguish it from all the other ones that have all the same symptoms? Well, there it is. Blood-tinged sputum. Okay? All right, this one, not so much fun. It's called blastomycosis. Transmission, inhalation, caused by blastomyces dermatitidis. Okay, it can cause either acute or chronic infection. Primarily affects the lung, may spread through the bloodstream and other areas, example, skin. The reservoir is wood or soil. All right, so that's where you can get infected with blastomycosis through, I guess, contact with wood and soil. So the treatment may not be required if the infection stays in the lungs. If it doesn't, then you have to take months and months of antifungal treatment if the infection spreads and to blast it away. All right, so we'll remember that. Next is pulmonary aspergillus. So aspergillosis, pulmonary aspergillosis is caused by aspergillus, a mold. Okay, so mold, it can be very dangerous. It's a mold found in decaying plants, stored hay, compost piles, excess dust accumulation. Spore is transmitted through inhalation. It may colonize the upper and lower respiratory tract. The treatment is antifungal drugs, sometimes administered by IV. All right, so IV antifungals. All right, so we have 20 questions here. What is the primary cause of SSSS? Staphylococcal scalded skin syndrome. And the answer is, and I'm probably going to just kind of skim through this because you can go on your own, but it's Staphylococcus. So I'm not going to waste my time through these questions, but make sure you have the PowerPoint. Make sure you go through these questions and explained answers. And I also have some more practice questions and your highlights, my review guide to you, and your annotated lecture PowerPoint should help you. All right, so with that, I let you go and I bid you adieu, au revoir. I will see you soon in a couple weeks, and I hope you enjoy this lecture. And if you have any questions, email me. Bye.